Benedict Owusu, and it's always fun having him, especially these times when we're in COVID and we have to do these interactions right from home. It's always fun. But wherever you're watching us from, we say get interactive. And some of the best platforms we have on social media when it comes to the media are always embedded on JoyNews, Joy FM, etc. So get on to JoyNews TV, Facebook, same goes for the handle on Twitter, JoyNews TV. And then ultimately get to JoyNews TV, which is our YouTube channel. But we need to have an interaction. We're talking the third years at senior high school, and then also the second years on the go track of free SHS going back to school. And we had a lot of reports aggregated right here the whole of yesterday from our correspondent about how the schools were prepared to arrive for the arrival of these students. But the main conversation is also about the reception and how teaching and learning would go for the teachers doing the instructions. Well, we want to have this conversation with that. So we're going to have the president of NAGRA, that's the National Graduate Teachers Association. And then also we have Peter Pate Anti, who is executive director for IFEST. And IFEST is the Institute for Education Studies. And he's already on stream. Good morning to you, Peter.
Good morning.
Yeah, great. And then we'll be joined by a lead management person with the Ghana Education Service. And ultimately, we're going to have a great conversation. We'll also open the phone lines towards the tail end of this interaction so that you are all let in the discussion. But Peter, let me first ask you, we arrived here because a decision needed to be taken. We're talking the COVID, the lockdown, and students were asked to go home. Now we know that we have to take some bold decisions, and the decision have been taken. What has been your observation over the last 24 hours following the return of students to the schools?
Thank you very much, and good morning once again to your viewers and listeners. Yes, that this has been a very difficult decision for all of us, parents, teachers, we who are studying the sector from afar, the ministry, Ghana Education Service, and even the students. There were mixed reactions when the idea was mooted that the schools need to be reopened for especially the graduating students, something that we at IFES have been advocating for over the months, that we need to make sure that these students exit from the system so that we have a clear pathway for how we go about our education after the coronavirus, or when the pandemic is brought under control. So there were back and forth here and there, but finally we are happy that schools reopened yesterday. I think it was Saturday, Sunday that the students were supposed to report on campus. And yesterday, most of them were allowed into the various campuses. And our small observation seems to suggest that the students are happy to be back on campus. The teachers have welcomed them. There seems to be a lot of energy from the part of the various school authorities, especially because most of the things that were supposed to be provided by the Ministry of Education and the Ghana Education Service seems to have been provided earlier before the reopening. And this is one of the things that we spoke strongly for, that to instill confidence and trust in the teaching and non-teaching staff, and especially on parents, because the parents would have to allow their kids to leave the house and come to school. The Ghana Education Service would have to provide the needed PPEs and all those things that the schools needed ahead of time to show as a sign, to show the parents, to show the teachers and everybody involved that, look, we are very serious about the health protocols. We would want to take very good care of the kids. And as soon as they get on campus, we are kickstarting the implementation of the protocols. And that is why when you look at your reporters reporting across the length and breadth of the country and the little observations that we have also picked from the ground, it seems that the reopening have gone on smoothly, and we are all happy.
But look, at the end of the day, the parents also were in on this. Their students are now in school. What are you expecting of parents, on the other hand, who are observing from home?
Yes, the parents would know this pandemic. It's something that is very tricky. So you would not be certain what is really going to happen to your world. I hope that there is a system of communication that have been put in place by the Ghana Education Service and the ministry, and probably the management of the various secondary schools, for parents to constantly get in touch with their wards. But one thing that the parents should be assured of, and I think that assurance should come from the ministry. This morning I was reading a message from the deputy minister assuring parents that they are going to make sure that every kid is protected from head to toe, so that none of them would encounter any kind of would put himself or herself in any situation that would make it difficult or for the parents. So the parents should be reassured of this. They should constantly be in touch with the kid and check up how they are doing. They should more probably be in touch with the teachers that they know they've been contacting over the years to check up on their kids for them. But they should not be so much eager to react in the event that there are rumors of an outbreak or whatever it is in a school. And that is the point that maybe this morning we would have to push across forcefully, that there will be rumors of outbreaks and all that since school have reopened. And that would trigger a lot of reactions from parents and maybe the management of the schools. What we would want to push is that parents should not be eager to quickly rush to schools to move their kids or take their kids to their various houses because there is a rumor of an outbreak in a school. I think that is something that we will have to deal with as the weeks come by.
If you look at the observations that have been made, critically by way of the management of the cases, it also means that there's some level of confidence as far as the international community is, even though there's some level of skepticism locally. But it still means that the management has been done in such a way that we should have confidence in the return of the students to school, of being kept well and safely, right?
Yes. But one thing that we have to also note and we have to also say is that at this stage, the responsibility shifts from the ministry and Ghana Education Service to the managers of the schools. And that is a point that we have to say. If they are not able to instill the protocols, if the managers of the schools, I mean the headmasters, the assistant headmasters, and then the teachers, the house masters, if they are not able to enforce the protocols, they are not able to check that the students are washing their hands, there is a lot of social distancing going on in the classrooms and in the dormitories and in the dining halls, I don't think that we can push that blame on the Ghana Education Service or the Ministry of Education. So this is a point that the management skills of the various headmasters have to come to play. And we hope that they would stand up to the challenge and ensure that students adhere to all the relevant protocols, that they will be masked all over on campus, that they would not be in any form of social gathering like meeting together to sing and jam and all those things. These are things that the managers of the school should take charge of and make sure they are held, they are done to its fullest. So the responsibilities keep shifting, whereas the ministry and the Ghana Education Service, we should continue to provide these things for the schools as and when they get spots or the managers need something. As they communicate to them, they promptly have to respond to them in terms of whatever they need. The managers of the schools should also, as a matter of policy, take it upon themselves to ensure the complete adherence of the protocols. And in any case where we have a break of the protocols in any of the schools, I think that they should be held responsible.
Well, we've been joined by the president of the National Association of Graduate Teachers, Angel Kwabena. Mr. Kwabena, thank you for joining us. Mr. Kwabena? Well, looks like we're having some difficulties. Please unmute your sound. Can you unmute your sound? Ultimately, Mr. Kwabena, I know you can hear me.
Okay.
Oh, great, great. Now, I would want to read something for you. This one is from the World Economic Forum site. And it says that the public health officials in the U.S. warned about the dangers to children if schools are reopened because of related issues about weather, cold, and then concerns about the state of the health of children before they come to school. You, as the teachers, apart from joining or having these discussions for a buy-in with the Ministry of Education, did you take consideration of other medical advice before agreeing to go back to the classroom?
Well, Roland, what the medical persons gave us was a blanket no, indicating to us that the numbers were growing and the...
No, this is bad. We have to take that question.
The fact that we had able to ask students to go to school. So that was what we communicated to government at that time. That, look, the medical people are telling us that the dynamics have not changed and they are still having problems in identifying the nature and behavior of this disease. Our numbers seems to be going up. So you recall that our first statement that came indicated that the grounds were not fertile for students to return to school. What informed that was our contact with some medical persons and the advice they gave us.
So you still went ahead despite medical advice on your side?
Well, you saw the intrigues that that our statement got, and the response they got. People sat on radio insulting us. There was one chief executive of one popular radio station chiding teachers here and there. You recall Professor Stephen Adair even saying that 50% of our salaries should be paid and so on and so forth. So the government had its way anyway, because the government indicated that, yes, all that they wanted is our input so that when they so decide to reopen the schools, then they will.
Please reiterate that point again. The feed has been bad over the last few minutes. So,
yeah, well, I'm saying that the
bad feed.
It was clear that the schools open, so we had to make suggestions as to areas that we can help to solve the problem.
Right. There's an incredible aspect of this that is important, of people aggregating or congregating together, and it's about the distance. What's the distance? Let me read this by you. In Switzerland, and this one I'm taking from the Wall Street Journal, in Switzerland, children at Geneva's Le Tour school had to adapt to new rituals. Classrooms were half full to reduce crowding, and desk space 2 meters into bracket 6.5 feet. We all know what 6.5 feet is. What's your distancing spaces in your classrooms, Mr. Angel Kabunu?
Yeah, well, the directive that has been given by the ministry is that a class size should be reduced to 25. So when you reduce class size to 25, it depends on the size of the class in the first place. As to whether that class size will culminate into 5 feet or 4 feet is a different matter. The classes that averagely were around 50 to 60, directives have been given that those classes should reduce to 25. Now, the issue is that the sizes of classrooms in Ghana are not the same. So when you reduce class size in, let's say, Achimota School, the distance is going to be different from the class size from Presbyterian Boys Secondary School Presec. So that will not mean that we have a standard meter space that should be adhered to, but the class sizes have been reduced to 25. That is the decision Ghana is taking.
Mr. Anti, what do you make of all this? You know, getting a buy-in from organizing institutions is important, but stakeholders and their interests and how they envisage, based on professional advice, a decision needs to be taken. It's also critical, is that not it?
Yes, and that is one of the things we've been pushing for, that in this sector, you have a lot of stakeholders. If you would want to say, ideally, your stakeholders are everybody, includes everybody in the country, because all of us have either one relative or the other, being a teacher or a student or an education worker. So you cannot take some of these decisions without involving the relevant stakeholders. I think that the teacher unions took this decision based on good faith, and I hope that they will not be disappointed by the relevant authorities with the good faith they have shown, because as he rightly said, at the beginning, there were a lot of reluctance from their side. Some of us came and were suggesting that if the ministry is asking for input, you go with the input, and then when any other thing comes out after that, then we can all come and then deal with it. Then fortunately, they did that. They have gone with their input. There were arguments here, there were disagreements here, that they had to make some concessions, especially with the testing of all students and education, the teachers. They agreed that the testing will not take place. So those are things that they have helped with the whole process. So I think the consultation has been good, let me say good, up to this stage, and going forward is going to be critical, because we are aware that a team was sent around to the various schools to check one or two things, and information were sent back to the relevant authorities. The kind of communication that will go on from this time around is very important. And you look at the guidelines that have been prepared by the Ghana Education Service. Some of these communications should go directly through their channels of communication rather than come to the media. What we would want to believe is that the relevant authorities are going to respond immediately they receive complaints and challenges that are coming from these managers of the schools. And it will not be like they have to, the teachers or the schools that are making such complaints would have to wait and call on the relevant authorities for a considerable number of times before they respond. If that happens, then they are breaking their own channel of communication, and that will mean that the school authorities would have to speak to the media, and that is one of the challenges that we have had over the years. So whilst they are insisting that the school authorities and the teachers should not engage the media, it's something that personally and our institute we agree to, so that we deal with the issue of rumors. The relevant authorities should also be very quick in responding to challenges that will come up. For example, the classroom size that you are talking about, it is true. Some of the classrooms are very big. So you are talking of 25 students, you'll be able to do your 25, and then you have spaces for the students. Some of the classrooms are not that big, so if you're talking of 25 students, you still have some closeness among the students. If these challenges are communicated, the relevant authorities should be able to come in as early as possible to address what should be done. Or when you do the 25 and your classrooms are not going to be enough, especially when you are bringing in the second year gold student. If you do the 25 and your classrooms are not going to be enough, you should be able to quickly communicate, and they communicate it to the relevant authorities. I mean, the Ghana Education Service, the District Education Office, or the Regional Education Office, or headquarters. They should be able to, as early as possible, address that particular challenge so that the headmasters and the teachers in the school would be rest assured that anytime these challenges come up, their issues will be addressed. I think that will be the bone of contention as we go ahead. How quickly the ministry and the Ghana Education Service will respond to challenges as they come up during this period.
I see. Very interesting. So let me pose this question then after this refrain to Mr. Angel Kwabena. And I'm reading this from the Mental Health Organization UK, its own website. And they have a dedicated site for coronavirus and the return of children to school after lockdown and restriction periods. And so I'll just read. The Royal College of Pediatrics and Child Health, they have put together what they call a guidance support for children and young people living with a range of conditions. And they have itemized that post-lockdown restrictions, they have identified that children or young people would have gone through a number of experiences. One, domestic violence, abuse or neglect, family conflict, financial concerns, either because parents have lost their jobs or their guardians have lost their jobs, worry about relatives who are key workers and continuing to work, carrying responsibilities for family members. They may have been hungry and lack nutrition. They may have been insecure in having good housing, etc., or living conditions. And as a result of that, they do some level of counseling. You, Mr. Angel Kwabena, what counseling have you gone through? What counseling have you given the children, their parents, before you tell them to make entry back into the classroom?
Well, let me state clearly that we are not professional health workers. So we will not be able to give that specific counseling that pertain to the health of the student with regards to COVID-19. By our training as professional teachers, we can give general counseling as to how you relate yourself to developing situations, how you psych yourself to get yourself into the frame of mind to study. It is going to be difficult because we are not in normal times. And the fact of the matter is that the students who are in school as I speak are in a state of apprehension. Likewise, their teachers. We are all trying to protect ourselves as much as possible. For example, yesterday, NAGRAT issued a statement to teachers not to receive or exchange books or exercise books with students. What that means is that even receiving exercise books and marking in itself is going to be a problem, because we all know that the virus rests on surfaces of materials, and exchange of exercise books between teachers and students will be one means by which this disease can be communicated. So it's going to be a very difficult interaction. I doubt the perfection of the outcome, because that is not the type of environment conducive for teaching. So this is where we are. And again, there is a directive that parents will not visit their children in school for the 6 weeks for the 8 weeks that they will be in school. Again, a parent being at home, not knowing the status of the child, again, creates a state of anxiety. So it is not a very welcome environment for teaching to take place, but there should be a standard environment where teaching and learning takes place. It is not the best at all, to be very candid with you.
Well, it's why I have to invite into the discussion the professionals. Since all of you, both you and Peter, you're deciding to recuse yourself from having the responsibility of counseling. Let me go to a lead psychiatrist, Dr. Ruth Ozeki, and speak to her on the related conversation about how we need to psych out the students, whether we've done that. Do we have you, Dr. Ruth Ozeki? Not yet. But Peter, if you do analysis of what has happened in some of the best jurisdictions, I'm not saying that we should be a first world country or a developed country, because we're not. At the end of the day, we need to meet each other halfway. Do you think we've done that before saying that the children should go back to the classroom, 3rd years, and then 2nd year go track students?
Yeah, so if you look at the countries that some of them try to reopen schools and others have actually reopened schools and the students are on campus. Some of them tried to reopen. I said that because they tried and then they had to shut down because there was a spike in the outbreak of the disease. So they would have to shut down. If you look at those countries, they all had their various protocols. The UNESCO released in May, they released 2 different protocol research works that all speak to how schools should be organized in the event that schools are reopened. I think the ministry took a lot of contributions from all of us, various stakeholders, and they have put them together to form a document that is supposed to inform them on how the various school reopening process would be. So yes, I think that there have been meetings here and there, and the associations, the relevant stakeholders, there have been points at this stage now for the reopening to go on. What I cannot say is the way forward as we have started the implementation of the protocols. And that has been one of the things that we've been talking about, that the real test will come when the students get to campus and they start the interaction. And my boss, Angel, is trying to tell you some of the challenges that they are likely to face in terms of marking and then going around to inspect students' work and all those things. I think these are challenges that will be on the ground, and that will bring out the innovativeness and ingenuity in the managers of the schools. So when I'm talking and I talk about we should be shifting responsibilities a little bit as we keep going, that is one of the issues I mean. So if you are going to teach students and when you give them assignments, you cannot mark because it is a possible way of transmitting or you getting infected. What can we do as a school in our own small corner? What can we do in order that we can still get a little assessment from the students and know that they are coping with whatever we are teaching? So these are things that the various headmasters and then assistant headmasters in charge of academics would have to think through and come out so that they will be able to safeguard not only the teachers, but also the students on campus.
Mm. In relation to what Mr. Peter Anti just said, what will you be doing, you and your membership?
Well, the first thing we will do is that we will stay alive. We will do everything. We will do everything possible to stay alive, but at the same time, take advantage of the opportunities that is available to impact some knowledge to the students. But let us get something clear here. These students had already finished their syllabus, and they were just about to write their WASE exams when the schools were closed down. So it is not as if we were so much behind time, because exams were just, in fact, practicals even had started in some practical subjects, so it is not too bad a situation where as if we were so behind time and the students are not prepared. So this period will just be some period of polishing up. It will not be the traditional teaching, so the interaction will be more, or will minimize more than it used to be. So we'll try and do that, keep our distance, advise students to keep their distance within themselves, and we make the best out of the issue as much as possible. But the primary thing we all have to do is to stay alive.
Mm. And ultimately, while staying alive, it doesn't mean you're neglecting, right?
No. You will not. You will be in the school. You will teach the students. It is not the way you and I were all. We were all in school. We know how teachers and students interact. There are some students of special needs that you even have to isolate and give them a little bit more teaching. All those things cannot be done. Generally, we will impart knowledge and then we see how it goes.
There's a concern. For example, I have a friend who works in one of the hotels where they kept some of the quarantine people, and he raised a concern that even the medical people who were supposed to come and have an interaction with them were shying away. Okay, because they've had concerns that some of their friends have passed on, etc. So there is that level of anxiety even within the professional groupings. We could have that uncertainty in that teacher to student contact, right?
Yes, absolutely. And even when we leave the schools and get back home, let me tell you the situation, my situation. When I get home, I'm asked to remove my shoes, wash my hands to my shoulder level, wash my face before I enter my own room, because that is the protocol in my house. And now that schools are open, I'm sure they're going to create some side bathhouse for me outside to wash down before I enter the building. So it's an indication that, look, your schools are open, teachers are coming from all over the place, students are coming from all over the place, you are a possible contact to the house, and so on and so forth. Again, now that it has been announced that some dormitories should be put aside as isolation centers, it means that when one contracted the disease, gets infected by the disease in the school, then the schools are also going to be isolation centers. So we have not succeeded in fighting the stigma thing in the country. And I hope and pray, and I pray very earnestly, that we don't have a situation where one school will announce that student A, B, or C has the disease, because I can assure you it will cause some pandemonium in the school. I know students, I've been with students all my life, and I know the reaction to these things, how it goes.
Right. Peter Auntie, I have my good friend who just sent me, Mr. Ampuma, and he says that the teachers have to wash their hands regularly, so the excuse of marking students' papers is no more an excuse. They can use gloves, etc. You've been provided with gloves, right?
Am I to answer?
Yes, you are the one going to do the teaching.
Well, I don't think gloves are part of the issue, but the gentleman who talked about the fact that you use gloves, does the person know what a virus is? Because when something is on the surface and you even use gloves, does that mean that there cannot be anything that gets into your nostrils or your mouth or your eyes or something like that? I think people should do some little bit of research here.
Peter, well, your organization definitely would have done some work, perhaps looking at maybe how prepared the schools, etc. We have gone through a number of the schools the whole of Monday. We'll continue to do that on Tuesday as well. How well, generally, have you concluded that the schools are ready, psychologically, administratively, and then physically by way of the structures, etc.?
Yeah, before I answer that, let me add my voice to the comment from the guy who said that they can use gloves and wash their hands and other things. I think that our teachers are very professional, and they know how to handle the students at this time. So we should not dictate to them how best they should go about the teaching and learning process. They know how to do it and get the results that they need, because at the end of the day, if the students don't do well, they would be held responsible. So I don't think that any teacher will say that I'm not going to do what I'm supposed to do in order so that I don't get the disease. At the same time, the kids would not be given the needed tuition that they need. So we should not try to dictate to the teachers how they go about the teaching and learning process. I think that is one thing that we should desist from, because they are professionals, they know how to go about that. Yes, we have done some few, we don't have that kind of strength and coverage like you people you do. So we've done some few checks in the Ashanti region and in Accra and then in the central region. And it seems that the schools were prepared, at least to some extent, let's say more than half, 50%, to receive the students with the education and then the kind of equipment that they needed, which were sent in on time. So in terms of that, administratively, the schools were prepared. Yesterday, we picked notice from the Western region that seems to suggest that some students who reported late in the evening were stuck somewhere, but I think it was quickly resolved, and then the schools were reopened for them to enter. So that is on the administrative side. For psychology side, I cannot say much about it, because even those of us who are not even teaching and we just have our family members going back to school, we're still contemplating on the possibilities of the person contracting the virus and the implications of that on the child, on the school, and then on even we, the family members. So I think as a country, we have not been able to deal with that particular variable very well in terms of psyching the general populace about the implications of contracting the virus and the issue of stigmatization that my senior brother talked about, in terms of in case that a student is seen to have contracted the disease, the stigmatization that will come with it. As a country, we've not been able to handle that aspect very well. And that is why even the more that we talk about adhering to the protocols, the more that people are resisting. You don't see people with the nose mask when they are in the public places. You don't see people doing social distances and all those things. So I think that is a nationwide problem that we would have to address. And the education that is supposed to be done by the Ministry of Health, the Ministry of Information, the NCCE, and all those people, they should intensify it, because it seems that we are not sure of what we are really dealing with. So in terms of psychology, it would be difficult for me to say that we've done a lot of work there. But for the preparation, since the students and the teachers are ready to kickstart the academic period that they lost and then lead to the writing of the exams, I think that it's quite in line.
Well, we have the head of psychology.